Hey guys, what's going on? Erica Lee, Elite Massage Therapy. I'm a PTA, licensed massage therapist, and a certified strength and conditioning specialist. In this video, I'm going to go over how to treat your own sacroiliac pain or SI joint pain. So let's take a look. So to start with, your sacroiliac joint, the SI joint, is the joint where your sacrum and your iliums of your hips connect. So essentially they're the dimple points in your back. You know that this is usually identified as the problem when you're having like one-sided low back issues that's like right above the glute, or every time you go to take a step you get a sharp pain. Might be difficult to bend forward or straighten all the way up. So I'm going to go over some simple stretches to help you address these symptoms at home. Alright, so we're first going to start off lying on our back here in a rested position, knees bent. Have a foam roll. Now you can use a foam roll or a rolled up towel or maybe even a ball, but something that's relatively solid. Place it between your knees, and all you're going to do here is just squeeze. So we're squeezing with our knees, pushing together. Hold for about 5 seconds. Relax. We push, hold, doing this with our legs, and relax. So what we're doing here is trying to help mobilize the sacrum itself. So you might get a couple of clicks and pops, which is perfectly normal and actually what we're going for with this particular exercise. Okay, so now what I've done is just got a belt, going to loop it tight together, and we're going to do just the opposite here. So get a hold of your belt so that we're not moving, or go ahead and tie it or cinch it. And you're going to push outward. So we're pushing out into the belt, doing an isometric hold again for about 5 seconds or so. Again, you may get a few clicks. You might have some discomfort on one side or the other. Try to complete 20 to 30 repetitions of these without stopping. If it's too much, just dial it down and start again. All right, so this next one is going to be a rotational of the hips. We're going to be doing an opposite push-pull. So I'm going to be pulling with and fighting the resistance here on this side, and I'm going to be pushing on this side. So I'm going to kick out with this leg, pushing into my hand, and then pull up with my opposite leg. So we're working a rotational component. So we're doing a rotation this way and rotation the other way. So then you just flip it after you complete 10 reps. Again, here and here, push and pull, kind of bracing yourself, doing an isometric push. Do about 10 repetitions of these, holding for approximately 5 seconds. Next here is going to be a posterior pelvic tilt. So what we're going for is not a lift of the hips, which is probably going to be pretty tender and pretty sore at this point. So what you're doing is just trying to brace your abdomen, so pulling your belly button down toward your spine and relaxing. So you're doing a slight tilt of the hips backwards, getting that posterior pelvic tilt, bracing of the abdominals, and relax. Again, you might get a couple of clicks or pops. Perfectly normal, perfectly fine. So now that we've gotten that worked out a bit, now we're actually going to try and raise into a bridge. So the bridge, I'm sure you're familiar with, just going to raise straight up here and back down. Controlled motion. You might only be able to go halfway, and that's fine. You might feel the first couple feel a little stuck, a little sore, but the more you do it, the higher you're able to go into it. So give yourself at least 10 repetitions of this, even if the first few you're going to do are probably going to be a little sore and make you jerk a little bit, but try and to continue to work through that motion. Okay, last one we're doing here for the sacroiliac joint is just a lumbar rotation. So you're going to rotate to one direction, trying to keep your opposite shoulder down to the ground or down to the bed, and just allow all this to stretch out. If that seems easy, you can extend the leg out further to deepen the stretch a bit. Extend your opposite arm to really get a nice stretch. You're going to hold here for about 30 seconds to a minute and then reverse to the opposite direction. All right, guys, well, that does it for the Treat Your Own Sacroiliac Joint Pain. So make sure you check out the videos for both the lumbar pain stretching exercises as well as some sciatic nerve exercises. It's all related. There can be several factors going into back pain. So try and check out those 2 videos too to make sure you're covering all your bases. I hope you found some value in this today. If you did, please hit the like and subscribe, and I will talk to you on the next video. Thanks so much. Thanks for watching. Take care of yourself.